Dr. Richard Scott, you are CEO of Genomics England and expert in genomics in healthcare. Can you tell us a bit more about it? What you're doing?
Yeah, so at Genomics England, we're a government-owned company, and our vision is a world where genomics plays a role in routine healthcare for everyone. And our job is to work with the NHS and with researchers to make that happen. So providing live services at national scale to the NHS for whole genome sequencing, and also helping researchers push the boundaries. And when they have discoveries that we think might be ready for clinic, helping them to prove that and think about how they might land in clinic, what evidence is needed for policymakers to adopt them. So our role is really about making that transition so that genomics can play, where it's proven, a role in everyday healthcare. It's just part of what you expect healthcare to be.
You have launched this newborn screening initiative. What is a target of this and how are you going to do it?
Our newborn genomes program, we call it the Generation Study, is asking a big question. It's a research study asking whether every baby when they're born should have whole genome sequencing, driven first by the potential we see for genome sequencing, reading the DNA sequence, to look for rare treatable conditions like those that are looked for routinely already on the heel prick test, but using genomics instead of chemical screening as the first test in. So it's asking that big question, developing evidence so that we can know in the future whether that is something that should be routinely offered. There's also some other really big questions there around public expectations on how DNA data might be stored for use routinely through the life course. And so we're understanding people's attitudes to that through the program as well, and supporting research so that it's not just today's knowledge that we rely on. We're also supporting discovery, for example, of how to better diagnose rare conditions and identify new treatments. So it's not just the 200 conditions that we'll return findings on during the course of our research study to families, but it's a greater number.
Which role plays the technology, especially cloud, in your projects and your initiatives?
As we work, if you like, we do three big things. One is that we offer services underpinned by digital infrastructure to the NHS and to researchers. We also play that role as a data and evidence engine to support the work of those people, but also the translation and the innovation piece where new technology, where proven, can land in real live healthcare and engage with the public. All of that work is underpinned by digital infrastructure and technology, and working with AWS and other partners as we build that infrastructure to know that we're working with really solid infrastructure that we can harness for those benefits that we think genomics can bring healthcare is absolutely critical.
And you need to manage petabytes of data in a short notice, right?
That's right. So we're talking about quite big quantities of data, as you say, tens of petabytes of data, making sure that it's held securely, making sure that the systems are really solid and reliable, and that they're systems on which we can innovate, on which we can test new technologies, and where they're proven, roll them out rapidly. And making sure that you've got that really solid infrastructure is absolutely critical to our work.
Thank you, Richard, for your insight. Thank you so much.
It's a pleasure.